What are the top 3 reasons that someone might want to get off of their antidepressant? My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. So let's talk about the 3 most common reasons that people want to get off of their psychiatric medication. And I'm talking mostly about antidepressants here. So the number one reason is going to be that it's not effective. So this could either be that you've started the medication, you've tried it for a couple of months, it's not doing anything for you, or it could be that you've developed tolerance, meaning that you've taken the medication for some time and it was initially helpful, but it doesn't seem to be working anymore. You might increase the dose and get a little bit of benefit from it for a short period of time. And then again, it feels like it stops working. This is because of tolerance. And of course, we don't want to be taking a medication that is not doing anything for us. The second most common reason is that people may be experiencing side effects or adverse effects from the medication. So this could be that it's negatively affecting their sleep, that it's making them more irritable, that it's causing sexual dysfunction, or that they've gained a lot of weight. Any number of reasons could contribute to them wanting to stop. And then lastly is going to be that people may just not want to feel like they're dependent on a medication. Maybe you've been feeling better, you're doing well, and you want to see how you do without the medication. Or maybe you've been on the medication for a long time and you don't want to necessarily take a medication for life if you don't have to. Now, how simple or complex it is to get off of this medication can depend on a number of factors, but the most important of which is going to be the length of time that you've been taking it. So if you just start a medication and you've tried it a couple months and it's not working, or maybe you started it and you're getting side effects right away, it's not in most cases going to be challenging to get off of that medication. If, however, you've been taking the medication for a long time and you're just like, I don't want to take this anymore, I want to see if I can get off of it, at that point, it can become much more challenging and it may require a much slower taper than would otherwise be needed. So these are the 3 most common reasons that I see people talking about. But if you have had another experience or another reason that you've had to get off of your antidepressants, please feel free to share in the comments below. I'd love to hear about it. Wishing you all good mental health today, and I'll see you in the next one.